Moving on, researchers in the UK carried out a large-scale study to understand the impact of COVID on obese people. Our next report tells you more.
Doctors have been warning that obese people have a higher chance of contracting severe COVID symptoms. A study conducted in the UK delved deeper into the issue. It analysed nearly 7 million hospital patients across the UK. Researchers found that people with obesity were much more likely to need intensive care if they got coronavirus. This as people with obesity have more inflammatory proteins, which are important in controlling the immune system and blood cells. There is also a higher level of these proteins in COVID patients. Researchers say that people who have both coronavirus and obesity are likely to suffer higher levels of inflammation.
If you're obese, you have a high cytokine activity. Cytokines are inflammatory markers, which are also important in obesity and ischemic heart disease and other associated things with obesity. So that's obesity and cytokines. And COVID and cytokines are also very closely related. And so that if you have a COVID infection, you have a cytokine reaction. And it's the combination probably of two different reasons for cytokine reactions.
The study pointed out that obesity has become a major health problem across the world. According to the World Health Organization, obesity has reached epidemic proportions globally.
Research really is important to understand whether by reversing obesity you reverse the increased risk of mortality and morbidity with COVID. And then how quickly, if you reverse your obesity, because this is really key at the moment, we're all talking about the huge number of people who have severe and complex obesity in this country, and many of them don't have anywhere to go for help and support.
Bureau Report, WION World is One.